And thank you for joining us. Today's webinar is Supporting Children Affected by Domestic Violence and Substance Abuse, the fourth of our new webinar series for substance abuse counselors and other allied behavioral health professionals working with women. Our trainer today will be Patti Bland, MA, CDP, and Director of the Substance Abuse Training and Technical Assistance for the National Center on Domestic Violence, Trauma, and Mental Health. Before we get started, I'll go over some of the technical details of the WebEx software that we will be using for today's webinar. Many of these details are also explained on the Using this WebEx System tab in the upper left-hand side of your screen. Please be aware that your screen might look a little bit different if you're using a Mac or a PC. On the right-hand side of the screen, there are multiple boxes. The second from the top is the chat feature. This feature will allow you to provide feedback and share resources with your fellow colleagues, as well as get in contact with the trainers or myself if you have any questions regarding the training content. You may contact Jennifer Curley, also with the Center, if you have any questions troubleshooting the WebEx software. To do this, click the down-facing arrow and select the person you would like to contact. You will see a lot of options, but for this session, you'll want to select all participants if you'd like to respond to a question from the trainer or contact me anytime during the session. You should click on Jennifer Curley to privately contact her if you're in need of troubleshooting the WebEx software. So let's test this chat feature. Will everyone please go to the chat box, click on All Participants, and type in what field you work in, such as domestic violence, substance abuse, the legal system, etc., and then press Enter. This way we can test the chat function and also get a sense of the different kind of work folks are doing. Excellent. You all can keep contributing to that if you like, and thanks for helping us test that. While folks can get a lot out of the chat feature, there are times when it moves really quickly and can feel distracting. If this ends up being true for you, you can feel free to minimize the chat box by clicking the arrow next to where it says chat. You can always open it again with the same arrow if you choose. We will be providing live captioning during this webinar. Below the chat box, there is a media viewer box. This will contain the captions. If you do not want to see the captions, you can click on the down-facing arrow next to the word media viewer the same way you might if you were going to hide the chat box. At the end of the webinar, you'll be taken to a very brief evaluation. If you could take a moment to let us know what was useful and what could have been better, we would really appreciate it. If you get disconnected at any point, please return to the email you received with the original webinar link and re-enter the training. If you're experiencing technical difficulties and are unable to contact Jennifer Curley, you may call the WebEx tech support to resolve any additional issues. That phone number is 1-866-229-3239, and we'll also post this in the chat box. Thank you all for joining us today, and I will now turn the training over to Patti.
Hi everyone, thank you for participating in today's webinar. I am delighted to have you here and hope that the information will be useful and that we can also have questions answered periodically throughout the presentation. Let's see if I can figure out how to move my slides. I always have a little trouble. Let's see. Okay. Oh, here we go. Apologize, everyone. I'm having a little difficulty. Okay. Okay. Wasn't working. Okay, thank you. All right, before we start, I want to let you know that while we have 90 minutes to talk about the subject, there's lots and lots of material that should be covered that we may not be able to address today just because the topic is so broad and overarching. So I wanted to make a special thanks to Linda Chamberlain of the Alaska Family Violence Prevention Project and let you know if you have interest in children's issues and the children's brain and neurobiology. She has put together some really interesting materials and booklets that are helpful, and all you have to do to find them is to click in, to go onto your internet and type in The Amazing Brain and Linda Chamberlain. She has a number of articles. And also I wanted to let you know that we have an entire series of training on children's issues as related to substance abuse and other concerns and trauma that is put together by Susan Blumenfeld, who is excellent. And those webinars can be accessed at our website, and I encourage you to look there for more information. And now we go on to the next. Every time you talk about substance abuse, domestic violence, children's issues, it can be a bit overwhelming at times, and so we wanted to remind everyone that you're encouraged to turn down the volume or take a break if things get a little heavy, and that it can be helpful sometimes to discuss what you're hearing with a trusted individual, and that follow-up technical assistance relevant to this webinar is available in a variety of formats afterwards. And so please do engage in behaviors that will keep you safe as you listen, because this stuff is sometimes hard to process. I'm going to skip this section because the goals and objectives will become obvious as we go forward. Mostly what I'm hoping we'll achieve is to examine our current practices and really to think of strategies that will help us do a better job looking at the needs of children and ensuring that they and their families are able to have safety, autonomy, and justice when they're affected by substance use, trauma, and violence. So I guess to start, I know when I first began doing this, I started working in a substance abuse treatment arena and then jumped ship and worked in shelter. And actually for, I'd say from the in the early 80s, I got into substance abuse work. By the late 80s, I had also began working in the domestic violence, sexual assault arena, and maintained a foot in the door of both fields straight up through the present day. And what was interesting for me working on both sides of the street was how many features were really common regardless of which field you were in. And there were things that seemed to overlap and things that seemed a little different. But what I noticed very early on was that there seemed to be a couple of ways that harm was experienced by individuals. And that when I would begin to think about abuse, I would begin to think about it in terms of an active form of abuse. And an active form of abuse to me would be something where another human being is actively seeking to hurt or harm someone else. And you'll see that in domestic violence or other forms of interpersonal violence. You'll see that in child abuse and neglect and sexual assault and child sexual abuse. Certainly in emotional, physical, and economic abuse. And of course, we would consider forms of oppression as abusive. And by that, I'm talking about primarily things like racism, sexism, classism, heterosexism, certainly ableism, and what we call in the alcohol drug field addict phobia, whereby a person looks down on another or feels that they are diminished by virtue of them experiencing a substance use disorder. So these are forms of oppression, and I would call those an active form of abuse. And then a lot of times I would think about when you see one form of active abuse, it's not unusual to see another. That's been my experience. It's not unusual. It certainly isn't always so, but it's not unusual to see multiple forms of harm being done. And for people that are experiencing multiple forms of harm, most people figure out ways to stay safe and do the best they can. And they may, not all, certainly not everyone, but many people do figure out ways to cope. And some of the ways they cope stop being so helpful and become problematic over time. And some of the helping skills or coping skills maybe actually become a form of harm, self-harm. And substance use can become substance abuse, or buying a lotto ticket, once every 6 months can be, spending all your money on gambling. So things are different depending on how people use them. You may find difficulties in terms of coping with either overeating, not eating, or purging, with compulsive spending or working too hard. I know none of us can relate to that, right? Or compulsive sexual behavior, or compulsive shopping, or shoplifting. I mean, these are all things that people might do, and oftentimes I would think of substance use primarily as coping abuse until I began working more closely in the domestic violence and sexual assault arena and began to hear stories from survivors whereby their partner actually forced them to use or misuse substances, to use more than they wanted, use their substance use against them, and realized that not only could some of these coping coping ways be used to try to survive, but they could also be used as a form of active abuse. So this is something that I'm hoping that you'll be thinking about as we go forward. And while I was sitting in Washington State coming up with all these active and coping forms of abuse and thinking about it on that line, in actual fact, excellent studies were being conducted on some of the intersections between multiple forms of harm. And certainly the adverse childhood experience study is something that, if you're not familiar and you haven't had a chance to review it, you can look at it in great detail online just by typing in ACE study. And that adverse child experience study, or ACE, actually really gives us information on the long-term effects of what can happen in a family when a variety of trauma exists. And let me go forward. So it's the largest study of its kind that was ever done. I think it had about 18,000 participants, and they looked at childhood experiences over the lifespan. And what they saw in that study was that growing up witnessing domestic violence and or substance abuse, as well as other experiences of trauma, could lead into organic disease and other trauma and harm later in life. So these are things to be aware of, that growing up prior to age 18 in a household with recurrent physical abuse or emotional abuse or sexual abuse, or with someone who chronically abuses alcohol or drugs, or when a member is incarcerated or chronically depressed, suicidal, institutionalized, experiencing a psychiatric disability, or where the mom is being treated violently, or where parenting and guardianship is unavailable, and when emotional and physical neglect exists, that these are long-term problems that can cause greater harm later in life. And I would say it's probably likely that anyone might experience any of these, but experiencing multiple forms of adverse childhood experiences seem to lead to greater harm. What hasn't been fully studied yet, and what needs to be looked at, I think, and in fact I believe that studies are currently in progress, are not just at the experience of this type of harm that I've just described, but I think it would also be important to look at growing up and experiencing racism or heterosexism or any other form of oppression or abuse that causes grief and pain and trauma. Should be included so that we can get a better picture of how people are experiencing harm and what kind of impact that has in later life. So we do know that a powerful relationship is revealed, and that time doesn't always heal some of the adverse experiences that are common in childhoods. And so that's something to be aware of. We don't have time to wait for people to grow up to provide interventions or to offer support. We need to be aware how we can support and assist people from an early age. And so the things that are really helpful to know in our work would be how to screen for substance abuse and other forms of family violence and child abuse, how to assess the risk factors and implications for children, and really how to intervene for the safety of children when substance abuse and domestic violence are both present. In terms of screening and safety planning and other areas, on our website we've put together a number of webinars that should be able to help you with quite a bit of that. And as we go forward today, we'll talk more specifically about addressing the needs of children. So the effects of trauma on children. I have to tell you, I think the first child that I work with that had, I think he was about 3.5 years old. He's 23 now. I remember him particularly because he was upstairs. He was about 3.5 years old, and he was upstairs, and he heard sounds of distress and realized that something bad was happening to his grandma. And he woke his mom up at 3.5 and said to his mom, "We need to call 911." And And his mom did indeed call 911. And assistance arrived, and help was made available, and the situation that night, the crisis, was averted to some degree. And I remember this child sitting there talking to this child. He was sitting on a desk chair, and he was so big, he was so little, the chair was so big, his little legs didn't even touch the floor. And I remember thinking, I should talk to this child. And he was just sitting there, and I kind of kneeled down so that we were level, instead of, I felt like the Incredible Hulk standing over him or even sitting across from him. So I kind of kneeled down in front of him, and I said to him, I said, I hear you were a very smart young man. You were really smart, and you helped your mama help your grandma. And he said, yes, yes. And I remember saying to him, you must have been really scared. And he said to me these words. He said, my mommy was scared. And that stands out. I think about a lot of the research when you read it doesn't necessarily translate into the online experience of what that means. Like, we know that children are affected by witnessing harm, but and we think about the harm that they're experiencing. But part of that harm is when they see their parent afraid or someone they love harmed. And when he said, my mommy was really afraid, I realized that must have been really scary for him. And I wasn't sure what to say. This was the first child I worked with, but I said to him, well, I guess it could be scary when you see your mommy scared too. And he nodded his head, and I said, well, what do you think would help you? What do you think would make it easier? I mean, I don't know what I was doing. I was just trying. I said, well, what do you think would make it better a little bit? And I can still remember that little kid looking up at me and saying, talking helps. And I said, well, what do you think you want to talk about? And he said to me, what I want to know is, can you tell me this will never happen again? And of course, that's not something you can promise a child. You can't say this will never happen again. And he was like 3.5, almost 4 years old, talking like this. And I said to him, I can't promise it will never happen, but since you were so smart and helped your mommy call 911, I know that you have a plan that works. And he said to me, he said, yeah, I do, but I had to have mommy make that call. And then he said, boy, those 911 guys were great, weren't they? They were just great. And I said, well, what would you like to do? And he said, I'd like to practice. I want to call the 911. I was thinking, oh my goodness, are we going to be calling the 911? But what he did was we went and played with a Fisher-Price castle, where we had a little Barbie on a car, and he had a big plastic phone, and he'd call 911 and say his address and ask for them to come. And then he'd make a siren noise, and then the little Barbie would go off in the car, and he would clap. And he did this for about maybe 2 or 3 days, and I was to tell you, I was getting a little bit tired of playing with the dolly and all this, but at the end of it, he stood up and he said, okay, I got it. I know I can do it myself if I have to. And he was like I said, not even 4 years old. And the funny thing is, like, when you think about working with children and spending time with them and getting them connected and making sure that they get support, referring them on for assistance, many kids benefit from getting some counseling if they've witnessed both domestic violence and substance abuse, or either one really on its own. But I think about this kid. He's now like 23 years old, and I recently found out what he was up to, and he's done really well. He's gone through college. He paid for his first 2 years of college doing, what do you think? He was doing patient transport at a local hospital. And I think of this kid as somebody who got support. I mean, I just had initial conversations with him, but one of the things that we did do was link him and his mom up for some counseling and ongoing support, and to really acknowledge what he was feeling and address it right then, to recognize that both the mom and the child and the grandmother in this case all had different needs that needed to be met, and that if we take prompt action and recognize that kids need services as much as their parents and vice versa, that we're going to be doing a great job supporting families. So with that said, I want to move forward and tell you that when parents are actually experiencing a substance use disorder, there's a lot of research out there that suggests kids are often younger the first time they themselves get drunk or get high, and that they often have more behavioral problems before they themselves find themselves getting hooked up with a treatment facility, and that we know that kids may develop dependence much more rapidly, and that kids as young, I'd say we used to be a little bit older, it used to be junior high age where we would see kids sneaking into the liquor cabinet or getting their hands into their parents' prescriptions or using other drugs, but the ages are a bit younger now, and so kids that are experiencing trauma may very well choose substances or look at them themselves, or if they witness their parents using, they may themselves use. And they do benefit from support, even if the support is not the parent or a traditional helper. If it is someone in the family or in the neighborhood or in the community who can provide positive support, it's very, very helpful. We know that when children are growing up in homes where substance use disorders exist, where one or both of the parents have a significant problem with alcohol or other drugs, that the kids a child may be at risk for being born with fetal alcohol spectrum disorder or alcohol-related birth defects. In fact, if you look at data out of Alaska, we know that there's a really high correlation between the experience of domestic violence and alcohol-related birth defects. The development of a substance use disorder is not uncommon. Eating disorders are linked. Learning disabilities are associated, and depression as well as stress and stress-related illnesses as well as neglect. And, you know, I feel as I'm reading the vetted, understood risks that children experience by growing up in a home where substance use disorders are prevalent, that really a lot of these concerns that we're talking about also exist in homes where domestic violence is present. I used to work in Washington State with a perinatal partnership against domestic violence, and we were looking at what kinds of harm kids experience when, the fetus is exposed to when domestic violence is present, and of course low birth weight is very high, and a series of other health problems. And when you looked at the health problems associated with domestic violence, many of the health problems were also connected to nicotine consumption and other substances as well. So the reason why I want to mention this is because it's harmful when you grow up witnessing a significant substance use disorder and are affected by that. It's harmful when you grow up witnessing or being affected by domestic violence. But when the two co-occur, 1 + 1 isn't 2, it often becomes 10 tons of trouble in terms of problems and stress and factors that are causing harm. So what kids, again, this would be from substance abuse sector, but I don't think it's much different from what kids learn in domestic violence, is that when this is going on, what you're going to do to cope, you're going to try to dodge things, you're going to try negotiating, you're going to try hiding, you're going to try learning. And the problem with both substance abuse and domestic violence is it's unpredictable. You never can tell from day to day what's going to happen, whether a parent will be drinking or using or not. whether a parent will be, or another person, a partner, will be harming another parent. We don't know. And so kids learn, they learn to adapt just to stay alive and just to function. These are things that are going on. And the other thing that we find when we talk to people who have experienced witnessing domestic violence, or who have experienced growing up in homes where a substance use disorder is highly prevalent, we hear people telling us, I feel like I was never a kid. I was never a kid. And sometimes the person telling you I was never a kid is 10 or 11 or 12. And so what we know is that children don't necessarily experience a carefree childhood. Many of them may act as little adults, and others may take on other roles. And they are extremely busy surviving, kind of placating, trying not to rock the boat, trying to pick up the pieces, trying to adjust to what's going on. And many of the children are very responsible, try to be really responsible. I think of some of the early work of Patti Bland, where she talks about the roles of children growing up in homes where alcoholism and other drug abuse is present. And you look at other literature on children who've grown up witnessing substance use going on, and the roles that are often described are that hero role where that person is really responsible, or the role of the scapegoat where the child is taking on a lot of the anger that exists in the family, where they're blamed for things, where they take on the belief that it's their fault that all this has happened, or where the person, where the child learns to cover up everything with a use of humor and acts like the clown to try and prevent, to try and prevent focus on the violence, or focus on the drinking and drug use, to try and change it up a little bit. And then the person at greatest risk in a family where this kind of harm is going on is often described in alcohol drug literature as the, quote, lost child. And that's the person that's no trouble, that's really quiet, they're hiding behind a cabinet, and or in another room, or just sitting there quietly, and yet they may be so affected and unable to articulate it, overlooked, and not adequately protected. So these are the kinds of issues that you hear about when you're looking at acute substance use disorder and acute substance abuse occurring in a family. And I don't think really, to be honest with you, that you hear much different when domestic violence is present. Again, I would say 1 + 1 is not 2. It becomes compounded and more of a problem. So what kids learn is you can't believe what your senses tell you. They learn to tolerate really intolerable situations, and they learn that you can't trust. You can't trust your experience, you can't trust your body signals, you can't trust your feelings, you don't trust yourself or others. And so a lot of times they will put up a big facade or a big mask, or they may be reluctant to disclose what's happened. I know when I worked with Child Protective Service Academy, many times that what I learned from child welfare workers was how often kids will often be reluctant to tell you anything, even though they're hurting or they're afraid, because their experience of lack of trust makes it hard. I mean, if you can't trust the people closest to you, it's going to be really hard to trust a service provider as well. And so they cover up and protect and accept rules, and really a lot of them, certainly not every case, but in many cases, they learn that if they don't rock the boat, things will get better, or that at least a disaster won't happen. These are the kind of things that when you build that relationship and children begin to trust you, you'll find out that they'll begin to share with you. There are, when you're looking at domestic violence and substance abuse, really what you see is 2 different sets of rules that exist in that house. And so the abuser's rules primarily are based on fear and domination, guilt and shame. And those really are immobilizing and frightening for kids, and leave kids constantly walking on eggshells. I would say that those rules also leave adult victims in a similar state. Rather than failure to protect, maybe adults are unable to protect children as adequately as they would like to, because the abuser is so dangerous and such a problem. The rules that kids learn is, if I don't talk, no one's going to know how I feel, I won't get hurt. If I don't ask, I'm not going to get rejected, if I'm invisible, I'll be okay. And if I'm really careful, no one's going to get upset. And if I just stop feeling and numb out, I won't have any pain. And as you know, I think that especially you work with kids, especially kids that have experienced child sexual abuse or who have witnessed really graphic incidences of violence, a lot of times they will describe stepping away from themselves or describe themselves as sitting on the window looking at what's happening as if they weren't part of the scene. And that would be a form of dissociation. It's a creative way of keeping safe, but it can over time lead to many problems, including a possible, certainly not for everybody, but for some kids, the possible development of a dissociative disorder. And that can pose another set of problems, because if you learn to zone out and separate and detach when you're frightened or scared or under siege, and separate, what survivors that have gotten older have shared with us is that people who are abusive, who are not necessarily in the family of origin but outside, may be able to get closer to you, or if your response is the creative response that served you well as a child, might put you at greater risk as an adult in some ways, in terms of being victimized by sexual predators and offenders. So these are things to be thinking about. Who can get closer when you dissociate? Oh, I'm having a little trouble moving. Here we go. So possible beliefs that children may accept is they'll get confused sometimes because the messages are mixed. And this is true, I think, in families where substance use is a major issue, where a parent has got a substance use disorder. And mind you, when I'm talking about this, there are all levels of substance use disorder, from early to middle to late stage. And as you move along the spectrum and the substance use disorder becomes more debilitating, you will see greater confusion and greater problems. A lot of times in early use, the impact, or if the impact is not as significant as we move forward, which is why you'll sometimes see in families like the older children have different skills and are affected differently and maybe less significantly than someone whose whole experience has been with someone who's either emotionally unavailable due to substances, or when the abuse has increased, if they're talking about domestic violence, the abuse has increased from occasional to chronic. So you'll see that there's changes in how children are affected based on their age, role in the age, and how long the problems have existed. What happens a lot of times is that love gets confused with caretaking. Now, if you're looking after someone or getting early parentification because you're trying to look after your parent, or where you see spontaneity, like where someone might be spontaneous, you might mix it up and think this is irrational, or you may feel that the idea of being close to someone is emotionally overwhelming because there's so much neediness going on in many cases, or the children may come to believe that experiencing anger as an emotion equals violence, or is an excuse for violence, drinking or other drug use. One of the real tragedies, I think, for kids, and for anyone really, is when you misunderstand a normal emotion like anger and equate it with violence. And what so often happens in homes where domestic violence is present is that adult person who is using abuse, who's hurting that the other parent, or that person is often saying things like, you made me mad, you made me do it, it's your fault. And they raise their voice and they say, I'm angry, and then they follow up with either emotional abuse or some type of physical harm. And so people get the message over and over and over delivered that anger is somehow responsible for what has happened, rather than the person chose to engage in abusive behavior. And so really, really important messages are that anger is an emotion, and that violence is a choice, that acting out, to say a mean thing, to be hurtful, to use physical assaults, to coerce people, to force people to do things they don't want, to be tracking, stalking, monitoring. Those things aren't rooted in anger. They're rooted in a need to control and a need to be in charge and to be. It's violence, and so I think that's very important that when we talk to the people we're working with, both adults and children, that we clarify for them, because an awful lot of people mix up violence with anger, and this is why I think anger management hasn't really been an effective tool when we're looking at domestic violence, because domestic violence is that pattern of chronic, use of power and control to get your way, and that is considerably different than being angry. And so in other internal messages that kids learn are, look, in the midst of this chaos, I've got to fix it, I've got to do it, I've got to take care of it. Or they may say, I've got to ignore it. That's where you're more likely to find people that zone out, but they're still affected. Or in the midst of chaos, I've got to make it better, I've got to deflect it, I've got to tell a joke, I've got to do something that will make this whole thing go away. So these are messages that people learn. And while it can be effective at helping to manage a short-term crisis, neither substance use nor domestic violence seems to be something that happens just once. They tend to be chronic, progressive, and they get worse unless something goes on to create more safety and health and healing. When we're talking about substance abuse, and certainly with domestic violence, these things continue to go on until the non-offending parent is able to feel safe, and the person who's doing the hurting accepts accountability for their behavior. And sometimes that happens, and sometimes it doesn't. It's a very difficult situation to be dealing with. Now, we've talked about witnessing, and we've talked about what it's like to grow up in homes where you're seeing both the substance use going on in a way that could be dangerous or harmful, and where you're watching harm happening to a parent. But kids themselves are also directly harmed by an abusive parent or caretaker as well. That is in a way related to the domestic violence. There are direct risks for children, and I want to talk a little bit about what they are, because whether you're working on the substance abuse side of the street or on the domestic violence arena or in child welfare, it's good to understand how people who engage in adult partner violence expose risks to children. So one of the things that we know, and this actually is from Ganley and Schechter, and those of you may be familiar with her work, with both of their works actually, that they have documented that the risks directly affecting children include children being coerced into abusing their mom or other adult caregiver. And you'll hear kids talk about this. There's a big case out of Western New York one time where conviction actually took place because the coercion piece was documented on a video clip. There was a video cam record where the abuser had his son photograph the domestic violence that he was engaging in directed toward the mom. And when the judge actually saw that, even though it only rose to the level of assault 4, he got a big conviction and was charged for every single incident of coercion on that, because actually seeing it is so much worse than hearing about it, I think. But coercing your child into harming the mom or another adult caregiver, whoever it is not uncommon. And it may be belittling comments or saying mom is too stupid or what have you to function. I worked with a child once who told me he was very, very worried because his dad had told him his mom wasn't smart enough to cross the street. And what was he going to do in shelter, because his mommy was going to walk him to the bus stop and had to cross the street, and he was afraid that he would be hurt. So those are the kinds of messages that is very harmful for a kid to get about their mom. This creates emotionally abusive environment And not only are they afraid themselves, but the witnessing themselves. Remember the little kid that I said to you at the front end of this talk, when I asked him if he was afraid, he said, my mommy was afraid. The fear when an adult person who's looking after you is rendered vulnerable can be overwhelming for children. And some of the abusive parents pose direct risk to kids by actually being physically or sexually abusive as well. They endanger children through neglect. A lot of that stems from their excessive focusing and controlling and abusing their partners so much that they're not paying attention to their child, and they're making it impossible for the other parent to look after the child as much as she would, or he, as the case maybe, would want to. And kids will often describe being ignored or neglected. Kids are prevented. I should say, let me reframe this. Abusers will, people who hurt others will prevent an adult partner from caring for their kids, and this can endanger kids, and it undermines our ability as providers to intervene and protect too, because they create such a terror and fear. If I tell, if I talk, if I let you know what's going on, bad things will happen. I remember working with a person who had gotten assistance, worked with child welfare, worked with the shelter, worked with treatment, and her husband showed up and wanted to be admitted into the house, and she said, no, I have a protection order, I'm going to call 911, and then you're not allowed to come in here, I'm working with child welfare, I'm working with shelter, I've got a protection order. And the guy said to her, well, you know, an order is just a piece of paper, don't open the door, I could set fire to this house before they ever respond. And so you can see how a person may open the door in a situation like that and looks like they're in violation, and yet what they have been is violated by the offender, and that puts her, or whoever the, you know, it could be male or female victim, but it puts the non-offending victim and the children at risk when you have people who are willing to go to whatever lengths are necessary to gain their way. From working in a substance abuse treatment arena for many years, I know that when a substance use disorder is present, people will go to whatever lengths are necessary to get that next drink or get that next drug when they're terrified or worried that they can't survive. But what I don't think people are aware of is that offenders will go to whatever lengths are necessary as well to gain or maintain control, and that they use coercion very regularly, and that coercion isn't necessary. It's not reliable, or I guess it's reliable, but it's like negotiating with an abuser is not very helpful, because what I've learned over the years from my work both in with batterers and with survivors is that people go to whatever lengths are necessary, particularly, you know, when we're talking about abusers, that they don't seem to have a stop place unless it can be enforced. So these are things that you want to be thinking about. And trauma impacts children, and it impacts early brain development. And kids who witness abuse of their caregiver, they have a variety of effects they may experience. Some will experience many, some few. It all depends. A lot of children are very resilient, and I think it's real important for us to see what strengths they have rather than just look at some of the negatives. But some of the harmful effects that can occur involve fear, sleep problems, somatic complaints, outbursts of aggression, and they may very well experience trauma in their thoughts, are preoccupied. They may find it hard to do their normal activities. They may have stomach aches and not want to go to school. They may demonstrate a lot of anxiety. So before I go forward, I'm wondering if anyone has any comments or questions, because I know it's kind of heavy having a conversation about a topic like this, and I'm wondering if anyone has a question or comment or something that they would like to bring up right now. I'm going to just take a second for you to think and type us a note or let us know what you're thinking or concerned about. All right. If someone wants to ask something later, we're open to that, and we'll look forward to hearing from you. So, again, going on, what's going on with kids, and this data is primarily coming from a domestic violence, family violence awareness project, a pediatric one, and so now you can see how things are quite similar in domestic violence and substance abuse. Because what kids will often tell us is that they feel guilty for the violence as well as for the substance abuse and not stopping it. So they somehow blame themselves for what's going on in the family, and that they grieve on a very personal loss for what is happening in their family and what's happening to them. Most of these children will talk about being afraid that they'll be abandoned, or they express emotions such as fear about the unknown or fear of getting hurt, fear of something happening to their mom or their non-offending parent or their guardian, whoever it may be. They are really often describing feelings of anger about the chaos, the violence, and the substance abuse. And when that anger is the primary emotion that they are getting used to, you find that they may take the anger internally, turn it inside, and direct it against themselves and find themselves depressed, or they may act out and become bullying or engage in comments or practices that are learned from what they're witnessing at home. And those feelings of helplessness and powerlessness are very common. A lot of the kids are really embarrassed by the effects of domestic violence and substance abuse at home. And I know from working in shelter, both in shelter and treatment settings, and working with children in both arenas, that embarrassment factor is a big one. A number of kids I work with that did call 911, they will start the conversation. They may start out with, "Please come help me, Daddy is hurting Mommy," or "Please come help me, I'm afraid, something is happening." And then the second sentence will be, "Don't put the light on, don't make the siren go, can you come the back way?" I work with a child who both the aggressor got abusive and was drinking at a ball game and engaged in abusive behavior at home, but her friend was sleeping over that night. And I remember, again, when she called for help, she not only was afraid for her mom and her kids and everything, but she was literally crying because now her friend was going to know what happened, and her friend's mother was never going to let her play with her again. So these are, the embarrassment factor, I don't know that it's talked about that often, but the kids are really upset by it. A lot of times they think they're the only ones this is happening to, and they will do anything to keep it quiet. Anything. Unless they're really, really afraid. I think that, again, I mentioned to you that my coworker, Susan Blumenfeld, has done wonderful webinars, and also wanted to let you know that we have tip sheets for supporting children and youth exposed to domestic violence. And I put the directions on how to find it on this PowerPoint so that you won't forget that you can have access to that information and it can be helpful. The thing that kids really need, I know this first half of the webinar, it sounds kind of overwhelming. You listen to this harm and this pain, and you begin to feel bad. I really want to stress that there are solutions, and that children who have lived through trauma associated with domestic violence and substance abuse come out on the other side, and many of them come out much better if they get support and they get assistance as soon as we're aware that something is going on. And there are things that we can do that can really support their outcomes and begin to create a path to safety and resiliency and a sense of security that is really important. And one of the most important things is helping kids develop a calm and predictable environment, to help them know to help provide that in some way, and to help them identify and express their feelings. This is really important. And to really begin teaching them at an early age to learn nonviolent problem-solving skills and healthy coping skills. I used to work with with children who were Head Start age, who had worried about their anger, or thought they were bad because they were mad. And one of the little exercises I used to do with the little 4-year-olds was we would play the little game. I'm a little teapot, short and stout. Here is my handle, here is my spout. When I get all steamed up, then I shout, tip me over and pour me out. Now you're going, what in the heck is Patti talking about? But it was an activity the kids could play. They could tip themselves over and they could laugh. And then I could say, boy, those teapots, when they get angry, they let a little steam out. Well, you're not a teapot, you're a kid, but what can you do to let a little steam out that doesn't hurt you or hurt anybody? And it makes you feel good about yourself. And they will come up with things, and really when you engage them and talk to them at their level and are appropriate developmentally, and of course whenever possible engage the non-offending parent in the process, it's really good. So these are just ideas. There's lots of little things that can be done, and again, I think when you look at Susan Blumenfeld's webinars, you'll get even more ideas. But to help kids learn, it's so important to learn it's okay to be angry at times, but there are safer ways of expressing it than hurting others or believing that we've done something wrong or that we're bad people. And that's important, to be able to look at their situation realistically and truthfully, and to be able to talk to them about it. I remember, like I told you, with that first little young guy, when he looked at me in the eye and he said, can you tell me this will never happen again? I would have loved to have said it would never happen again, but it could happen again. And kids really know, they have like little radar. They can tell when we're not being forthright or honest. You don't have to give them information over their developmental age or that overwhelms them, but we can be as honest and realistic and truthful as possible and give them skills and things to build their confidence and help them develop a sense of connection to others. This is really important. And particularly fostering their relationship with a non-offending parent and the siblings. So what kids need: the consistent, caring, responsive adults, and that healing starts with relationship. They need structure and clear boundaries, because sometimes they're witnessing things that are not structured, unpredictable, and where boundaries are violated. So they need to know their caregivers are in control. They need to know what's expected, what the rules are. They need to know there are consequences for behaviors. They need to know how and where they can reduce their anxiety level. And they need encouragement to explore their environment. Now, I have up here, they need to know their caregivers are in control. Sometimes, if you're in a domestic violence situation, you know your caregiver is in control, but it's too much control. It's overwhelming control. It's abusive control. So helping kids distinguish the difference between a healthy boundary and crossing a boundary, and what is and isn't okay, that can take time, and that may it can be begun to be worked at with a non-offending parent. It can be begun when they get linked up with a children's advocate or a children's counselor in a treatment facility, and in some cases ongoing support with a child therapist or family therapist is really helpful. Although I know that couples counseling is contraindicated in the presence of domestic violence, and I would think that it might be high risk to put a child in with a person who's engaging in abuse directed toward the non-offending parent or guardian or caregiver. So we have to be really careful when we're providing services that children stay safe. Children who witness a parent getting hurt by substance use and domestic violence, a lot of times they need support in naming and identifying their feelings. And they may very well benefit from books and stories and pictures that help identify what a feeling looks like and talk about what a feeling feels like. They need to be able to tell their stories and work through their experiences. And they can do this through play or art, music, storytelling, so that they can make sense of their world. Having really clear limits so that their self-expression doesn't infringe on the rights of others is important, and it's a process. You have to have a lot of patience. And they do need freedom and permission to be themselves. This is really important when you're working with kids. They need choices. They need to feel that their confidence can be trusted. They need skills. The young child I work with wanted to know how to dial 911, wanted to feel confident that he could do it, wanted to know that if a problem happened again, he could call, because he said, those guys are really great. Those guys are really great. He had a positive sense of them, and they treated him very well when he came in, and he had that sense of connection. So when we are able to do that, it can be really helpful. To help them with social skills, not only teaching but also modeling, demonstrating, and practicing what is appropriate behavior. Children, it's been my experience, and I expect it's been yours too, especially any of you that are parents or aunties or looking out for the kids in your community. You know that kids pay a lot more attention to what we do rather than what we say. So we have to really model what is and isn't appropriate behavior. I'm putting up here some faces of our future because I was thinking about what I just said about modeling appropriate behavior. I had the great good luck to work up in Alaska, and I began working up there, commuting actually from Seattle in the early 90s before I moved up there permanently. And I used to work on and off and do training and technical assistance with the Tundra Women's Coalition. And that program was an interesting program. The executive director of that program at the time was really committed to kids' issues, and she hired a JV to provide children's services. That young woman who did that later moved on and became the ED, and currently there is a newer ED who just got on who also shares a commitment to children and children's issues. And what they did was they began an after-school program for kids so that children could come and participate. And those kids grew, and some of those kids are now working in the field, either of domestic violence, substance abuse, or something else. And that program helped give people ongoing skills. They didn't think this was something that you could have a conversation with on a Monday and everything would be fixed on a Tuesday. They were really committed into providing ongoing support. Over the years, now this all started in the 90s, but over the years they also began developing a project called Teens Acting Against Violence, the TAF program. And the kids have gotten together and written skits and written plays and put together, participated in developing PSAs and providing support one-on-one in their community and in the area on the Delta, and have really created something that was sustainable and supportive for children. And it was really funny. I remember meeting one of the kids that I'd met back in the 90s as an adult, and his picture's not here or anything. I want to maintain confidentiality, but I remember joking it to him and saying, hey, if you keep this up, he was doing volunteer work at the shelter. I said, if you keep this up, we'll have you be the ED one of these days. And he said to me, Miss Bland, I have bigger fish to fry. I have bigger things to do. I'm going to be working at the national level to end violence against women and children. You can bet on that. I just want you to know that prevention efforts and implementation efforts and efforts of developing services, that all like a multi-prong approach where things are looked at from multiple angles and kids are involved, are probably the most useful interventions we can do. And I want to show you another shot of the kids from Bethel. There they are, cheering and working against violence. These are teens working for a better world. And many programs have Girls on the Run is another great program out of Juneau and Southeast Alaska and other places where girls are building confidence and learning to feel good about themselves. There's a lot of programs that support the work that we're doing, whether we're dealing with people who are growing up in homes with substance abuse, domestic violence, or other issues. And for anyone interested in the Teens Against Violence, you can contact Tundra Women's Coalition in Bethel. And for those interested in Girls on the Run, what's being done in Southeast Alaska, you can contact the Aware Shelter in Juneau. So if you look at messages for children that are helpful, the ones that are the most critical to get out there right away are the following. Drinking, drug use, and domestic violence of your parents or caregivers is not your fault. So if someone you love is using, you didn't make it happen. That's probably the easiest way of putting it. That drinking, drug use, and domestic violence of the person that's hurting your parent or hurting your guardian or hurting the person that looks after you, that drinking of that person is not the fault of the non-abusive parent. In some cases, I mean, parents and guardians can be male, female, men to women. They can be any kind of configuration. The most important piece is to get across that if someone is drinking or using in your house who is also an abuser, it's not the fault of the person who isn't abused. Okay? Now, you do need to know, as people working in the field, that many people who hurt their partners use substances to hurt their partners, and they try to control their partners by forcing them to use, making them use more than they want, threatening that if they call the police, they will tell them they've been drinking. They will tell child welfare they're alcoholic or have a pill problem or a substance abuse problem, all this stuff. One of the things that we did in Washington State I found really interesting was when we had the treatment alternatives to street crime, where people would get evaluated in terms of parenting, etc. If a person who was identified as a person who'd engaged in domestic violence directed against another partner, if that person made allegations of drug use, the task not only did the drug test on the parent that the allegations were made against, but they also did the drug test on the parent who made the allegations. And I have to tell you, most of the time they were more likely to find the drug use on the alleging parent who was also an abuser. Sometimes they found the drug use on the non-offending parent, but a lot of times once it was brought to the attention and the parent was able to feel safe, they could actually engage in treatment and supportive activities. The problem with when domestic violence and substance abuse co-occurs within a family is that if the non-offending parent wants to get clean and sober, the abuser does not want that to happen, because if you get clean and sober, you're harder to control. So the abuser will actively undermine any treatment efforts and try to prevent the person from using or sabotage their recovery. There's a lot of documented cases of this, and recently the center has worked closely with the National Hotline to do a survey, and we will be releasing the data on that soon, which will give you some really horrifying statistics and numbers on how often co-occurring substance use coercion, and indeed mental health coercion as well, is present. So these are things you want to be thinking about. Instead of thinking, oh, this person in an abusive relationship is using substances and looking at that in a judgmental way, it may be helpful to think, if this person is using, is the abuser contributing to the use, making it worse, preventing them from getting help, and what do I need to do in my safety planning and my planning for both the adult and working with the child? What can I do to reduce the effects of the domestic violence so that substance use recovery is indeed possible? And if the offender is using substances, you know, what kinds of risk assessment do I need to take? What kinds of safety plans do I need to make? If I'm working with adults and children, I may very well need to know what do you need to do to get safe if you think that someone in the family is going to start drinking, or what if they pass out, or what if they're hungover? What do we have to do then? So we're going to have a lot of work to do. Kids need to know that each of us is responsible for our own behavior, that feelings don't need to lead to substance abuse and they don't need to lead to violence, that we have the capacity to engage in self-control. And kids especially need to know in a way that is manageable that there is no safe level of alcohol use for children and teens, and that it's not okay to hit or use violence. I had to go out to Kodiak one time. I never forgot it. They asked me if I would come out and talk to the kids, and they told me that they wanted me to talk about substance use and violence in the home in a way that wouldn't upset them, but that would get the message across. And the school that I went to had kids from all different ages. It was really a nice group of people, and I remember going in there and thinking, what am I going to do and what am I going to say? And so instead of me going in and saying to the kids, this is what happens when you drink, or this is what happens when you see violence, I reframed it and said, what do you think might happen if? And the shocking thing is the kids were able to tell you everything. Like, we think that we're going to be talking to them about something they don't know, that they're not aware of. But they were able to talk a little bit about it. And I said, well, what do you think would be the best way to handle it? And what I found out is the kids often had really good skills and they were willing to share it. And so these are things I think I always say when working with adults, don't launch into a safety plan, ask what you know and what you've done up till now. I think the same is true for kids as well. I had to do some more work with kids in another setting, and this was awful. I remember I was sort of all prepared and I was going to try what I had tested out in Kodiak when I went to this next place. I think it was up in Chenega, also in Alaska. I had all the kids at the school. And I remember walking in the door and they said, are you going to be another one of those grown-ups that just tells us how bad alcohol and drugs is and blah, blah, blah? And I was like, we've been getting lectures for the last 2 days on everything. And so I took them all to the gym. And they said, we're going to the gym? I said, yeah, we're going to the gym. And down to the gym we went. And I taught them a New York street game called Pies, where all the little kids each kid is given the name of a pie, whispered to them. You whisper in the air. One person is a baker, and all the kids are pies. And so I whispered in the baker, I was the baker this day, I whispered into each kid's ear what pie they were, like blueberry pie, chocolate pie, pumpkin pie. And then you have like a little witch that comes and knocks at the door and says, do you have any pies? And I say, I don't have any pies. And then the pies all go bub, 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 like they're bubbling in the oven. And then the witch says, I hear them bubbling in the oven. And I say, can you guess what floor they're on? And whatever floor she says, like floor, you just spin her around 4 times. And then the witch says, do you have a vanilla pie? Well, there's no vanilla pie, so the pies just sit there. Do you have a butterscotch pie? There's no butterscotch pie, so the pies just sit there. Do you have a chocolate pie? We have a chocolate pie. That chocolate pie has to run down to the end of the gym and back again and hope the witch doesn't catch them. If the witch catches them, she gets to be the baker. The baker gets to be, if the witch catches them, the child caught gets to be the witch, the baker gets to be a pie, and some other thing I forget. But the whole thing is, I'm getting confused. I should write it down for you how to do the pie game. The whole thing is that the kids got to run fast and they need their speed and they got to be able to move. And most of them are able to escape. And they run to the end of the gym and they run back and they sit down and they go woo. And you're probably thinking, what does this have to do with substance abuse? And what does this have to do with domestic violence? So we played until they were exhausted. They were falling out laughing. They were bubbling. Then they were making up weird pies like red car pie or garbage can pie, or to try and trick the witch. And it was like a total blast and a lot of fun. So while they were laughing and laying around and falling out, I said, man, can you think what it would be like to try and run if you were drinking or smoking? And then the kids were going, oh my God, yeah, if you're smoking a cigarette, you're huffing and puffing, and they were acting out, being all slowed down. I said, you couldn't get away from the witch if you were doing that now, could you? And they were going, no kidding. And then what would happen if you were drinking? And then they were stumbling around the gym. But the kids then said, oh my God, drinking or drug use will mess us up, or it'll mess us up. We can't escape the witch. We can't win the game. We can't do as good. Oh man, this is fun. And I just want to tell you, you can communicate information without having these really upsetting conversations. Sometimes you can demonstrate it, model, use games, and be creative to get the message across. And it's really funny because now there's all these kids out in Southeast Alaska who are playing pies, but I don't know if they still remember that it was an alcohol drug exercise. We just threw that in at the end. But they learned that you can keep safer if you can run faster, and you can run faster if you're not using or drinking. So it's just a simple message, but it's a message that begins to play, and they can build on it over time. Does that make sense to you? I hope so. You probably think I've lost it, but I find that working with kids where they're at and not scaring them, and then lowering their resistance so they don't just think that you're preaching to them, is much more effective in getting basic information across. And they know an awful lot what's going on. So messages for kids. With some kids, it's helpful to say, other kids who find their parents, like if you're having a conversation with a child and they mention, I don't know what to do, so-and-so passed out, or I might say, a lot of kids who I talk to who tell me they see one parent hurting another, or tell me that their parent was passed out or something. They tell me like they're scared, or they feel like they did something wrong. Do you ever feel like that? I might talk to them about it in that way. And then if the truth is discussed, kids begin to, if the truth is not discussed, kids really begin to mistrust their own feelings and perceptions, and they think things are often worse than they are. Whereas if you can say, well, it's not unusual, people talk about that all the time, and when you've been scared before, when you've been worried, what did you do? And to validate what they did, and if what they did is alarming or frightening, to offer them something simple that they can do. And of course, I haven't said it, I'm taking for granted that everyone knows here when people are talking to you, if anything rises to the level of child abuse or child sexual abuse or neglect, that there are cases when we are going to have to make a mandatory report. I didn't design this workshop to be around conducting mandatory reporting, etc., since the laws and rules vary from state to state and locality. I'm making the assumption that all of you who are here understand the rules and regulations in your own state. So with that said, it's all about the relationship. It's all about the relationship. When people feel safe, all the data tells us that you as a provider, as an advocate, as a substance abuse professional, as a child welfare worker or investigator, or in the courts, that if you take the time to get down to the level of that child and help them feel that positive regard and help them feel connected, that it can have long-term consequences. And I always think, like in villages, certainly I've worked in Alaska for the last 10 years. There's always someone in the community who is a positive role model. There's always, as much harm as we see anywhere, there are usually people that we can engage to assist us in the process. It's no joke when they said it takes a village. It takes all of us to be on the lookout, but not all the time. There may be times when we are there in a counseling capacity or as an advocate or in a court setting where we're focusing on what that child needs at that moment. But all of us can give a positive message that you're a smart young person, that you are creative, that you're bright, that you've been doing the best you can, that you admire this child, that you think this child has a lot of potential, that this child is creative, this child colors great pictures, this child can make music on the piano, this child is a good singer. To find those things and foster those things and encourage children is really, really important. And it doesn't take every minute of every day to do that. So, interventions with kids. If you're going to be working with kids, along with helping build their sense of self-worth, it's also important to help develop a safety plan to protect kids. And to keep in mind that each child, keep in mind their family's age and, the members of each child in the family's age and developmental stage. So you want to support the parent, caregiver, and the child relationship. That's important, as well as develop a safety plan that can be done with both adults and children. And so the things that are really helpful is to talk to the non-offending parent and the kid together sometimes with the kid alone, but usually it's best to do some of this work together when possible. So you might want to talk how the child can escape from the house if assault is in progress, where they can go in an emergency, how to call a supportive family member, friends, and what community agencies are there to help them. If children are suicidal or violent toward other family members, it's real important to develop a plan for their safety and the safety of others and to engage in therapeutic support. It's going to be really helpful for that child to get linked to services as soon as possible. And parents are going to need to set clear limits with children who are violent and abusive or who are using substances themselves and refer children to appropriate services. It's amazing how much kids know about substances even if they're not using themselves. If you want to know how much kids use about substances, we used to, at the transitional housing program where I was working with women who were experiencing substance abuse and domestic violence in their kids, the parents really wanted the kids to get taught about alcohol and drugs. So what I did, instead of going in and teaching them, I said, well, why don't we turn it around and have the kids teach us about it, because they all think that we adults and their parents don't know anything about anything. And so we had kids like from the 3rd and 4th grade all the way up to about the 8th grade. And the kids went and they did the program, and we had a little dinner, and the kids got up and taught us what they knew about alcohol and drugs. And it was an opportunity to see what they knew, where they were at, also to correct misinformation, and if they said things that concerned us, to follow up later. But it was less threatening and less boring for them, and they were more likely to listen when they felt that their input was important. So engaging kids, I think, is really critical when we're talking about, instead of going in and saying this, this, and this, not just setting limits, but getting input from kids on what limits should be and what do they think is happening and what is their experience like. To let kids know it's important for them to be safe if their parent is being assaulted, and to make sure they don't intervene, because the children that get hurt tend to be kids that intervene, and the younger the child is, the greater the likelihood of serious physical harm. We want to reassure kids that their parent, that the domestic violence and the substance abuse, again, is not their fault, and that blaming themselves is a common reaction. That's not unusual, but it's not their fault. The kids get tired of hearing you say it's not your fault and roll their eyes, but you know what? You can't hear it enough. If the child is called on to testify, it's real important to develop a plan to support the child over the issues of fear and anxiety, divided loyalties. A lot of times they feel a lot of loyalty and love a person who's harmful to their parent or to them, and we really need to take that into account. And also, we want to let them know how they can call their local domestic violence service program and substance abuse treatment program to get information and services for kids. This is when you're working with the children and adults. You want to make sure referrals given resonate and are culturally relevant and appropriate. You need to know your community. You need to know what it's like and where they can go, whether or not there's Al-Anon or Al-Atat or Al-Ateen or Nar-Anon the same for children and adults. You want to practice the safety plan with both the survivor and the kids, and let the kids know it's okay to talk to you about family violence and about substance abuse. This is all important stuff. The safety planning activities that are critical are in planning for when a person who hurts someone, or what we would call like in a court setting. When I'm working in a rural village, if I go up there and say abuser or perpetrator, people can't even relate to that because it's people they know. If I'm in a courtroom setting or working with law enforcement, I may use that word perpetrator. So depending on who you're talking to, the language is going to shift. So we need to safety plan for when a person who's hurting someone, or also known as the perpetrator, poses immediate risk to the family, to the adult parent, or to the child. We need to know how to safety plan with the adult survivor, how to safety plan with adults for child's protection, and we need to know how to safety plan directly with the child to ensure the child's safety. We also need to know how to ensure our own safety, because offenders, they threaten the child welfare workers, they threaten the advocates, they threaten treatment providers. They can be terrifying. In my experience, I've had abusers, people who have hurt others, show up at the parking lot in a treatment facility, pitching a fit, come to a shelter and threaten to burn down the back stairs, and that only happened once in 30 years, so I don't want you thinking that's the norm. And nothing happened, thank God. But I've worked with countless child welfare workers and GALs and CASAs who've also been threatened. Abusers are dangerous not just to the family, they're abusive and dangerous to all of us. And we need to have plans for our own self-care and our own protection, and to address the trauma we experience by being exposed to people who harm others. We need to validate the adult survivor's experience and avoid blaming language. Be respectful. Offer support and empathy. It's important to say, I know you're doing the best you can given your situation. What have you tried up till now? You want to take a universal stand against violence and offer information. Tell them that they've done fine. What else would they like to try? Is there anything else that they have thought about but haven't been sure would be effective? You may need to explain some of the dynamics of domestic violence or what a substance use disorder looks like, but it has to be done without giving the message that it's their fault. You want to let them know these things happen, it's not your fault, what can I do to support you and help you, and what strategies are you doing to keep yourself safe and go forward with your life. You want to build on a person's strength and let them know ways that they can, or explore ways used to protect themselves and their kids, and to talk about ways to escape abuse or maintain their sobriety and health. I'm not giving you a list of all these things because the survivors themselves and the kids themselves have often come up with phenomenal ways to do it. Your job is to listen to what they've done and figure out if there's other things they could try also that they might find useful. You want to really validate the courage that's demonstrated by the children or the adults telling you the story, and the fact that they even asked for help. And also you're going to want to engage when possible, when it's safe, because sometimes if a person's family has if there's a history of domestic violence, the domestic violence person, the person who's hurting, and some of their family members may not be safe to engage on the level that we would like. So you're going to want to look, though, for strengths in our familial, religious, cultural, or peer support systems. Whatever is providing support for an individual and their children is really important to be aware of. For adults, they have a hard time. Sometimes they're ambivalent. Choices are overwhelming. They're afraid if I throw this person out, the kids love their parent. It's all mixed up sometimes. So it's important to help people figure out what their options are and what the consequences might be, to recognize real fears and cultural concerns. I mean, some of you who know me know that I'm a bicultural and I'm a dual citizen. I am a citizen of both the United States and Ireland, and until recent years, there was no such thing as divorce in Ireland. Culturally, the notion of separation, I mean, there were a lot of challenges. Even today, while divorce is allowable, it's not usually the first, second, third, fourth, or fifth thing, and separations are there are, so we have to. They're not necessarily going to be the first response. Leaving is not necessarily going to be the first response. So part of our work in safety planning has to be on what to do, whether you're in the relationship or out of it, whether you're using or not, what factors can be done to support the person. And to ask questions like, in what way can I or others be helpful, and what do you want to do? What do you think will work? And to really be sensitive to the fact that how people might operate in Ireland or Alaska or Florida or New Mexico or wherever you live, wherever you're from, may be different. And so look into elements that might be barriers. If people have a hard time getting services in rural areas, if there's no detox available, or if the shelter is 4 counties away and this person doesn't want to go, you know, this doesn't mean there's something wrong. It means we need to look at other ways to support this person and make sure that they feel that they can stay safe and that their kids can be safe. So the key questions to close are, what can I or others do to help you? What do you need to feel safe or sober? What concerns do you have about your kids' safety? What have you tried in the past? What worked? Would it help now? What have you done to stay clean and sober in the past? Would that work now? Who in your support system will help you? Can we involve them now? And is there anybody we need to be concerned about who could undermine you? Those kinds of questions. Those are key. And to really help prepare a safety plan when leaving that looks at both substance abuse and domestic violence. Is this person going to need shelter? Are they going to need detox? Do they have their immigration papers, their tribal registration forms? Can they call 911, or do they have warrants? Are they afraid to do it? You know, do they need to change how they travel, where the school is? Is a protection order a viable option? All these things happen. And I would really encourage you to take a look at the safety planning webinar that we already have up at our NC National Center on Domestic Violence, Trauma, and Mental Health website that can get into this in more detail, the safety planning aspects. And then, I think I got to move here, just that I have so much trouble getting my thing to go. I think I lost it. I don't know what I did. Anyway, I lost my slides, but mostly what my slide says is thank you very much for attending, and gives you some more resources at the end to look up. I know that we covered a lot of topic and we covered it very fast, and I thank you for participating and encourage you to look at our other materials and for safety planning, and to let us know what else you need that would be helpful. And now I'm going to turn this over to my colleague, Erin Tinnen.
Great, thanks so much, Patti. I want to thank Patti Bland for such an exceptional webinar today. Thank you to Caption Colorado for providing today's captioning, and thank you to Jen Curley for making the webinar run so smoothly. Last but not least, thank you all for spending your time with the center. Within the next week, I will send you all a follow-up email with a link to the recording of today's webinar, in addition to the slides and handouts that Patti referenced, all of which will be available on our website. And you will also receive a certificate of attendance for your time today. At the end of the webinar, you'll be taken to a very brief evaluation. If you could just take a moment to let us know what was useful and what could have been better, it would be greatly, greatly appreciated. Thank you all again, and we hope you have a great afternoon.